Well, one of the major reasons why I requested to meet you
Yes.
was to try and induce Japan to help Sri Lanka, because right now we as a country are going through a very, very strenuous period in terms of tackling corona. There are many shortcomings and deficiencies presently in the health sector, specifically because of the load, the high load of people who are infected, and more specifically there is an important need for mobile hospitals, and there's an urgent need for more ICU beds. Right at this juncture, there's a scarcity of ICU beds. We also have shortages in various drugs and medicine. And also there is an urgent need for PCR machines where you're able to do testing on a mass scale. And I believe there are also issues related to availability of oxygen cylinders. So there are a multiplicity of challenges that the Sri Lankan health sector is facing. We are also faced with a number of human resource problems. If one listens to the various statements made by the PHI union, the PHIs stand for Public Health Inspectors. They are one of the main frontline health personnel and specialists, together with the other medical personnel, including doctors, nurses, and public health midwives, who are performing a remarkable role, yet challenging. And under these trying circumstances, it is my duty as the leader of Janabalawe, the main opposition of Sri Lanka, to cast aside our political differences and to show our support to strengthen the resolve and the mental strength of those who are in the front line trying to cope with this disease. So even though we have political differences, we belong to different political parties, we believe in different political ideologies, visions, but facing this national crisis, I would even go to the extent of naming it a national catastrophe. This national catastrophe has to be addressed through unity, and we in the opposition are united in our voice in making a very humble appeal to yourself and to other nation states to contribute in terms of medical items. As I mentioned to you, specifically setting up of mobile hospitals and the rest that I just mentioned to you. Both your great country and ours have had a very long history. We have had a very, very cordial relationship, a very constructive and progressive relationship. And we all remember very well that in the past your great country has contributed immensely for the economic and social development of our country through a variety of development programs supported through JICA, JBIC and various other financial instruments available to the Japanese government. So at this particular juncture, I want to make this humble appeal on behalf of all Sri Lankans to use Japan's capabilities and good officers to provide maximum available support in the health sphere so that Sri Lanka, through a united effort, can overcome the COVID menace that we are facing at this juncture.
As I said, we remain committed to continue our assistance to meet this difficult challenge faced by all of us. Thank you very much.
Thank you very much.